Morning. Well, welcome to our second panel discussion for Facebook Live from Carbon County Memorial Hospital. We're going to introduce ourselves again like last time, and then if you have questions, why, feel free to type them in and we will address them one at a time. So, starting on the end.
Hi, Dr. Cunningham. I'm the OBGYN here at Memorial Hospital.
And I'm Dr. Zimmerman, one of the ER docs here, and I'm County Health Officer for Washakie County.
Dr. Abels, semi-retired emergency room doctor, head of the coronavirus committee here in the hospital, trying to help prepare as best we can for our citizens.
I'm Stephanie Chu, and I'm the medical director of the clinic and also the chief hospitalist.
All right, welcome everyone, and thank you for joining us for the second panel. So with that, Dr. Zimmerman, we'll let you start things off this morning.
So up to 212 in the state, and every county, not every county has one, but it's slowly going up. Certainly we're not getting the same numbers that they are in the East Coast, but we know it's slowly coming, slowly building. So new directives have come out from the governor that extended all of the shelters as far as going into restaurants and the public distancing of 6 feet. All that's been extended through April 30th, but we don't look like our peak's going to reach until after that. So those orders probably will be extended also. Our peak will probably be in early May, the rate that we're going. So other than that, not a lot of new information. Treatments are pretty much stable. We really haven't got anything new or magic that fixes it yet, but studies are ongoing. So we'll be ready for questions.
There was a question also that was submitted earlier that the nursing panel had given some statements about asymptomatic patients. Of course, we had discussed those also. The problem is that everything changed in between the two discussions. The nurses were giving out accurate information, but asymptomatic patients, there is more and more stuff coming out, and that's the reason that the CDC recommended that we start making our own masks and wear masks now too, which was not present in our previous discussion. Because asymptomatic apparently, possibly, this is possible, can spread it by simply talking and breathing. But once again, only possible. There's so much we don't know because it's a novel, i.e. new virus, and we're learning every day.
That also changed how we track down positives too. From a public health perspective, we used to just go from whenever they had symptoms, we'd go back to see who they'd been exposed to. And now we go back 48 hours prior to when their symptoms developed and track down those people also they were exposed to. So that's just because we feel like there's more risk for transmitting it even though they weren't symptomatic at the time.
Yes, and shedding the virus 48 hours before you're ill is like having the chicken pox. Everybody used to shed the virus for several days before you got chicken pox, and then that's why it erupted in huge clusters. The same concept with a lot of viruses.
I guess I can talk a little bit about the Women's Health Clinic. I mentioned last time that we would be starting to space out the OB visits a little bit. We've started to do that. So far that's going well. We've done some phone visits, we've done some Zoom telehealth visits to kind of fill in the gaps where we're going a little bit longer stretches than we normally would between OB visits. Just trying to keep our trying to keep our pregnant patients safe, keep them out of the hospital when they don't necessarily need to be. And our office is in the hospital, so trying to keep them home and then let them self-isolate as much as they can so that they're safe, so that they potentially won't be bringing anything in as well. So we've taken some of those steps. We're continuing to reschedule or push out annual well woman visits and non-urgent gynecology visits, trying to do refills over the phone and things like that. So we're taking steps in the Women's Health Clinic to try to help you stay safe as well.
So over at FPC, did that cause feedback for everybody else? Okay. So over at FPC, so we have split the two clinics in two different locations. So at our FPC clinic on 3rd Street, we're going to be seeing the acute patients who are sick, so in terms of if they have cellulitis somewhere, they have any kind of respiratory illness, strep throat, anything where somebody could be potentially infectious, they're going to be seen over at our family practice clinic. So we have reopened Wagon Circle as instead of just the visiting specialist, which is normally, cardiology, dermatology, we're going to be seeing our other patients who are not acutely infected with anything. So anyone who needs to come in for like high blood pressure checks, for diabetes checks, things like that. Once again, this is another attempt for us to separate people who have risk factors and are clearly sick, and decrease the chance that other people could be contracting coronavirus from them. However, like we talked about, how if you're asymptomatic, you can still spread the virus. We're still doing our best in terms of in the waiting room, separating people out by 6 feet. We're also trying to bring our patients back as soon as we can into a room. So you might notice a little bit of a process change that in the past it used to be, you were only going to be taken back once the MA was ready, came and got vital signs, things like that. However, now we're going to bring them back first, and then the MA might come back later, get your vital signs, but this way then you're already separated into your own room, and it decreases the time that you're going to be around somebody else. One thing that I don't know if this will be a question that comes up, but these masks that CDC is recommending that we wear, it's not so much to say, all of us are now protected against getting the virus. It's because of that asymptomatic period for 2 days where you could be spreading it and not realizing it. So if all of us are wearing the mask, if we're asymptomatic, we have no symptoms, but we're actually spreading the virus, then this makes it so you decrease the chance that other people can catch it. So that's just something that I know is a little bit confusing, because everyone kind of thinks that we're wearing this to kind of protect yourself so you're not getting it. Really, it's so then if you have it, you're not spreading it before you have symptoms. Of course, the other things still stay true, that if you're sick, stay home, don't be around other people, things like that. And then we also have, the same guidelines of when to seek treatment and when to, stay home and self-quarantine.
And social distancing has been shown to decrease the rate of spread of this infection. The mask is merely adding to that upon the CDC recommendation that the population now consider making their masks and using them. But still crucial, when you take the mask off and when you leave, you gotta wash your hands.
We don't have any questions at this point, so.
Hopefully we do get some questions. That's probably the biggest reason why we do this, is try to allay some fears or misconceptions or questions that are floating around out there. So please, if you have any questions, just type those in.
And I have a topic, because I had to address this in my home county. So let's talk about empty hospitals. There's a lot of conspiracy theories going on, and you see them on the internet a lot. One of them was people filming in empty hospitals and then sending the videos in, and they're showing empty hospitals or parts of the hospital. There's a good reason behind this. All surgeries have been canceled. There's no outpatient procedures. The coffee shop, the cafeteria, the flower shop, gift shop, everything's closed. Employees that would normally park in one area are parking in a different area because there's like 1 or 2 doors to these big facilities they have to go in, because they all have to be screened for COVID symptoms. And then all the COVID positive patients are pretty much grouped into certain areas of the hospital. So certainly there are areas of these big hospitals that look totally abandoned. And it's not because the work's not there, it's because it's been really concentrated in certain areas. And so it's not a conspiracy theory. This is not fake. They really are having a lot of sick people, and they are getting overwhelmed, especially on the East Coast. New York, New Jersey, Baltimore now as it moves down the coast. New Orleans is being hit hard. Detroit. So the bigger cities are becoming overwhelmed with patients. And so if you see the empty hospital thing, you'll kind of, that's why it's empty, is because it's changed the flow of how patients come in and out. And certainly most of the hospitals closed. So.
And remember that healthcare providers are going to have to be here on the trenches, so to speak. But we forget to thank our people in the grocery stores, truck drivers, people that keep the power on, or are still working essential duties, putting themselves at risk for the general population. So if you see somebody, don't forget to thank them.
From a distance.
Yeah, keep your distance 6 feet.
Without a handshake.
Without a handshake, yes. No hugs.
So we do have a question from one of our local pharmacists. How would you like pharmacies to process refill requests now that there are multiple clinics? Thank you, Chris at Walmart.
So really, it's going to be the same process, because even though we're in two different locations, we're still going to be accessing the same system, same Athena. So do it exactly how you have been doing it, because even when we do get refill requests, they don't go to a specific location, they're all electronic in the cloud. So keep doing it the same way that you have been doing it.
And we're trying to address more electronic signatures and prescriptions out of the hospital. So far, the program we do not know about yet, because the pharmacist had a legitimate question about that from the emergency room, also in the hospital.
So with that, can you speak to some of the telehealth services that are being discussed and that we are looking at as a facility to help transition away from some of the face-to-face appointments?
So one thing we do is telephone visits, so that's where, you call and you're talking to, the patient and the provider are calling and talking. Sometimes, there are things that, especially if it's something that's more, I have pretty well controlled depression, but I changed the medication recently, and I want to talk about how I'm doing, that's one that usually is more appropriate for that environment. If it's something, though, that's more like, okay, well, I'm having, a little bit more shortness of breath maybe, and then it might be helpful to have more of a telehealth option with Zoom conferencing, or something where I can see you on your phone and you can see me, and then that way I can kind of do a little bit more of a physical exam just by looking at you. Otherwise, though, sometimes ultimately in the end we can only do so much with the telehealth visits, and you might need to come into the visit, because if it is something where I'm really worried that your oxygenation is low, things like that, then we might need to have you come in. So there's different varying levels of different services we can offer, and different levels are appropriate based off of what complaints patients have when they come in, what illnesses they're worried about, or what diseases that we're treating. Ultimately, though, what I've kind of found is that even when we opened up the clinics and we had our health, had our chronic illness versus our acutely infected clinic, I still had a lot of patients who said, I'd still prefer a phone call, because, in case I'm running 30 minutes late, you don't have to sit in a waiting room for 30 minutes before you even go back. It's kind of nice, because if I'm running late, then I call you later. You can still do other things during that time, and you don't have to be somewhere else. You can just kind of take that call or take that video conferencing call whenever is convenient for you, which is kind of nice. Also, it enables me to be able to have, hours that our clinic's not traditionally open. So, if it's like 5:30 to 6 or something, but that's when somebody gets off of work, then I can kind of set it up that that's when I'm calling them. I just had a patient yesterday who scheduled an appointment at 5:30, because that way then I can call him, check in on him without saying, oh, well, you need to take off of work early to get in to see me.
So do they still contact the clinic as normal to make that appointment? If it's going to be a phone call, they still go through the same process, is that correct?
Yep, and then they'll go ahead and notify us through the scheduling that it's going to be a telehealth, so either a phone call appointment, or it's going to be a conferencing, where a video conferencing phone call, where we can then see you and be able to talk to you face to face. With all of those things, we just also get consent, because some patients, might not realize that it's an actual telephone visit, which you can be charged for. So then we usually get consent to say, is it okay that we go ahead and do this? Because usually when you come into the clinic, you might not read all the paperwork, but part of the paperwork actually says that you're consenting to be treated, that you've agreed that you're going to see somebody, and we're going to, bill your insurance company or bill you. And so that's why we then also add that part to the telephone phone call. It's not that it's different from the visit, it's just that instead of physically signing something, which we can't do over the phone, we then get your verbal consent that, yes, this is okay, and you understand it's a visit that will be billed to your insurance or to you separately if you have a copay or whatnot.
Thank you. Okay. What other topics would you like to address from a physician standpoint?
Okay, so let's do a little bit between the flu, going back to we did this last time too, between the flu and the current coronavirus. Statistics are still just as bad. The flu kills 0.1%, so 1 in 1,000 you may have a fatality. This one may be as high as 1% in the United States. It's a lot higher in other countries, but looks like it's going to be 1% or a little below here, but that's still tenfold more than the flu. So if 1 in 100 die from it as opposed to 1 in 1,000, it's still bad. We know that it's very much skewed toward the elderly population, with like 22% above age 80. So 1 in 5, if you're over age 80 and you get this, it's pretty significant chance of death. So that's why we're concerned about kids and people taking it home to the elderly, because if they get it, regardless of the care we give them, there's a 20% chance of death.
And there was a question from our last session that we did not get to about should we just isolate the elderly and getting back to work and things like that, because this is a huge concern for people. Feeding your families is not to be ignored. The reason that this is difficult is because of the asymptomatic carriage, and you go visit your grandmother or your father or your mother, and they can get ill. And the mortality rates are still significant with people above 50, not just the extreme elderly. And so these are the concerns, but we appreciate the concerns of people that have to take care of their family too. And I unfortunately do not have a good answer for that, because what we do medically is suggest isolation and things like that, unfortunately. And then if somebody has symptoms and you're home isolated for 2 weeks, that's very difficult on families. We appreciate that, but that's what we have to consider as medical personnel.
Thank you.
Somewhat related to that, with our pregnant patients, there are recommendations that are coming out, not from CDC at this point, but from maternal fetal medicine groups, so high-risk OB groups, that suggest, or at least say consider, pregnant women staying home from work if possible, starting at around 37 weeks, and intensively self-isolating at home. That way when you do come into the hospital in labor or for delivery, for induction or C-section or what have you, that you've been isolated as much as you can. I mean, we understand that there are financial considerations to take into account, but I am bringing that up as something to discuss and to consider, as you know, a safer alternative in these challenging times that we're in. Is consider staying home if you can once you reach 37 weeks or so.
And what are you doing for labor these days, Dr. Cunningham?
For labor, like we talked about last time, we do allow one labor support person to be with you. We're one of the just a couple of exceptions to the no visitor rule. So as of right now, one person can be with you in labor. You will see all of us wearing masks during your whole time in labor. When it comes time to deliver, you will see us in our N95 masks, the more the higher filtering masks that we have, as well as gowns and gloves, and I'll have a face shield on. So not what we're used to necessarily, but we do consider delivery an aerosolizing procedure because of the pushing and such. So we do take more precautions when you're actually delivering. We are also having patients and their labor support person wear masks, a simple mask, for the entire time that they're in the hospital. So that's relatively new. So those are some of the changes on the labor floor.
In the emergency room, when you come in now, there is a quote-unquote dirty side, which means infection side, to try to isolate as much as possible in other patients visiting the emergency room appropriately for their chest pain, strokes, everything fractures. We're still treating patients that need treatment. So the conception that hospitals are fading away from treating other patients has been discussed in my forums for emergency room physicians, and we are dedicated as a group across the nation to take care of everyone in spite of this COVID-19. So if you have chest pain, you have stroke-like symptoms, you have severe, significant abdominal pain, and you're getting dehydrated, your sugars are completely out of control, the emergency room is available still. We've divided the floor also. I think that project is finished now,
Yep.
where we have an infectious site for the entire ICU and an entire floor, non-infectious sites who are still taking care of patients for acute problems in this hospital. Elective surgeries have been restricted across the nation significantly. And certain procedures we're trying to delay. Now, eventually, we'll have to address this down the road, should this virus not fade this summer, because we just don't know at this time. We hope it's like the influenza and other coronaviruses that do fade in the summertime.
Okay. So we do have a question. Can you explain the testing priorities? Can you please explain what to do if you think you have coronavirus but do not meet criteria for testing?
The state Wyoming lab does, if you're ill in the hospital and hospitalized, they will accept the test. If you're a healthcare professional that meets certain illness criteria, they will be tested healthcare professionals first. Not that healthcare professionals' lives are more valuable than anybody else's, just that if the entire hospital gets sick, then you got nobody. I want to emphasize everybody's life equally valuable. And then pregnant ladies also are a priority for this test. If you have symptoms of COVID-19, home isolation for 14 days is recommended. That's because in spite of all the politicians talking about the miracle cures, we have actually no studies that show any benefit for any of these medications at this time. And the current medications that they're looking at do have significant side effects and toxicities. So we have to be aware of that also. So basically, unfortunately, I deliver incomplete news, and this is what we got. Mostly because the Wyoming lab is overwhelmed, only have a certain amount of swabs and test kits available in our entire state. And this hospital has tried to contract with several different professional outlying labs. They are not accepting any new contracts or any new samples from our hospital. So here we are. Does that answer your question?
So
I feel like better safe than sorry, so even if you've healed and you're not having symptoms, still wearing a mask, for at least 7 days after your last symptoms. Really anything at this point, it's better to be, overkill and do too much versus too little. So even if you feel like, okay, I'm great and I'm not sick anymore, wearing a mask, that just will help, in case you're still spreading the virus, even though you don't have any sick symptoms any longer.
Yeah, the current data on spreading the virus after you're well is incomplete. We don't know. Before you get sick, that's been finally brought to light by studies that you are infectious before you actually have symptoms. The reason we don't know about the after illness, how long you shed the virus, is because the tests we currently have will test and sense if you have destroyed virus or active virus. We can't tell the difference at this point in time.
can you explain what a surge is? What is the definition of that?
I wish I had a blackboard. You want to try this
Sure.
one?
So we worry about surge capacity. We worry about if we have enough medical personnel and equipment to take care of a certain number of people. We know a certain number of people are going to get it. We just don't want them to all get it at once. And so we want to decrease that surge of patients that all get the COVID virus and are sick enough to come to the hospital. Because once again, most people who get this will not be sick enough to have to come to the hospital. They'll have cough and fever, and they'll stay at home and it'll be fine. For those that have to come to the hospital, though, we don't want to have that many here at one time that we can't take care of. And so that's the surge we're trying to decrease. We're going to try to keep the number below where we can maintain adequate care.
And if you have 100 patients that get the disease, 20 out of 100 patients will end up hospitalized. So in Carbon County, if we get 2,000 people sick all of a sudden, that means 200 would potentially come to the hospital. We have 25 beds. So if the surge peaks and crests over the dock, shall we say, the system gets washed out.
And then we would have 10 of those in the ICU, which we can't contribute that either. We do that percentage. The percentage that come to the hospital end up at ICU beds requiring it, and so it gets overwhelming.
And we have 4 ICU beds currently.
So the surge has to do with both the number of patients involved and how quickly they come in. So if you look at those graphs, it's how tall the peak goes and how quickly it rises. So you've heard the term flattening the curve probably. When that curve rises quickly and goes high, it can exceed our capacity to, or any hospital's capacity to adequately provide good care. And so if we can flatten that curve where it doesn't go up as steep, not as many people at one time, and stay below, our bed level or our ICU level, and not tax the hospital as much. That's obviously what we're trying to accomplish by social distancing and self-isolation and those measures.
And with social distancing, by the way, make sure that everyone around you is aware too. Right now, if in any evening you go down here to Walmart or City Market and you walk in there, you're going to find entire families, mom, dad, 3 kids, all going in when only one really needed to go. You'll see the elderly who someone should have gone shopping for them. So reach out to the people around you and go shopping for them if there are people at risk. And if you're at lower risk, and if you have large families, why designate someone to go do the shopping so that not all of them are in there. But any night we can go up here and see lots of people in the stores that should not be there.
But I appreciate most of the citizens when I do the shopping, since I end up doing the grocery shopping in my household. I notice that most people are in the stores really paying attention, trying to social distance. More and more people are getting their masks when they go to the store. So the overall cooperation in this community, I do appreciate.
So tied into that, can you explain the criteria for hospitalization?
So there's a few things that we look at. So it's not one magic, if this number, and this number are hit. It's kind of an overall picture. So really, one of the big things is if somebody has what's called hypoxia, so if your oxygen level is below a certain amount, and that we can't get it up without a risk that you could get a lot sicker. So if it's something where, maybe you only need half a liter of oxygen, you look pretty good, you're up walking around, it's something we could consider sending you home from either the clinic or the emergency room with a little bit of oxygen. If it's something that looks like, somebody comes in, they're really confused, they require a little bit more larger measures like a CPAP, and CPAP is where you have the mask that pushes air into your lungs. Those are people that are unlikely to do well when they go home. So there's a few different criteria that we look at. Everybody's different too, so not everyone's going to have the exact same cutoff. Also, some people, they might say, here's my clear cutoffs, but then somebody walks in, they look fantastic, or somebody comes in and refuses to stay in the hospital, which happens sometimes here, and wants to go home. So there's a few different criteria that we look at. Same with if they're ICU versus the medical floor, and then also if we need to do an intubation versus if we try some other measures too. So there's just kind of a long way of saying that it's kind of, I guess, part of the being a provider is using that assessment to judge where somebody needs to be and their chance of deterioration. So number one is how sick you present with when you come, and also with different risk factors like labs, and also those different parts of how you're doing, how confused you are, how likely you are to get really sick versus somebody who looks like, okay, you might be able to go home. But regardless, even then when we say, okay, I think you're safe to go home, sometimes we can't predict it correctly. We don't have a crystal ball, and that's why we give really strong what's called return precautions, that if you're getting worse, if you're getting more short of breath, to come back in. Because just because at this moment you don't need to be hospitalized doesn't mean that in a day your symptoms don't get worse and then you need to be hospitalized at that point.
And that's the thing with older patients, in particular over 65, is the cutoff currently, that people can get sick more rapidly, and we have to try to educate those people with them as well as the patient that there are certain things that you end up coming back to the hospital for. But the idea is to keep people out of the hospital so that you don't get other people sick in the hospital. And obviously, if you come to the hospital to visit, for whatever reason, there's always a risk for that infection being transmitted.
From an ER perspective though, if you have chest pain, or you feel short of breath, like you walk across the room and you're winded, or you can't say a long sentence without getting winded, you need to come to get evaluated. So you're obviously not oxygenating like you should, and that BS need evaluated before it gets worse.
And a phone call to the ER to discuss your symptoms would be recommended, because then we can better recommend to come in and also then stay home for the isolation. But even if we tell you stay home for isolation, like Dr. Zimmerman talked about, if you get worse, you gotta call us, come in.
Okay, so Dr. Chu, I have a question for you. You stated that 7 days after the end of symptoms, have the guidelines changed? I thought it was 7 days from the onset of symptoms and 3 days from the end of symptoms. Can you clarify?
Yep, so that is how long you need to self-quarantine, self-isolate for. However, I would say even after that, and this is not necessarily what the guidelines are, but me personally, if I had it, I would still wear a mask after that for 7 days, just in case. But like Dr. Abel said, we really don't know. We don't know that if you're spreading the virus, that we can actually tell if it's killed virus, if it actually is large enough amounts that you could actually get somebody else sick. But we do know that, you can spread it afterwards. We just don't know the significance of if you actually can't get someone sick from it. So even though we would say the self-quarantine rules still apply and are the same, I still would wear a mask though, just because in case you are still infectious to other people, this kind of covers you. We might find out though in 3 months that, oh, it turns out that after your symptoms go away, there was nobody that was actually able to infect anyone else. I just kind of would say better safe than sorry that, you wear a mask for a few extra days and find out you didn't need it versus the opposite way.
And the thing is that, as you know, that we are pushing for everybody to wear a mask anyway.
And the cough will continue. Even after your 14 days, you may still be coughing. Your fever may be gone, you may have the body aches, you don't feel short of breath, but the cough will be, at least the people I already know who have recovered, the cough can continue after that 14-day period, so all the more reason to have a mask on.
Correct.
On the CDC, it shows a peak on March 19th. Have we met our peak, or is that still to come?
It's still to come. Ours is not going to be that far.
The CDC, one that I read 2 days ago, was May 1st for Wyoming. It's expected a peak for the state. Now they do not define it per city or county, unfortunately.
Yeah, there will be different peaks for different areas of the country. Obviously, Washington was kind of the first area here, and then New York is getting.
Yeah, New York, I think, is at their peak, they think, right now.
Probably.
They
So-
think.
They
Don't
hope,
know.
yeah.
Yeah, so ours will be later. It's, we're more rural, more isolated, ours will be later.
And it also depends on what we do. So if we all keep practicing our social distancing, yes, but if it's something where, all of a sudden we all decide to go have a big block party and everyone's mingling, it's going to extend that, further out, and it's going to keep going, and more people are going to get sick. So that's why it's a really important thing that it's not necessarily just a waiting game of when this comes, that we still have to actively, be social distancing, wearing masks, doing really good hand washing.
And the likelihood of the state of Wyoming extending this from the governor, it appears that they will extend these dates, school closings, etc. Don't know that, that's just what I've heard from the state offices.
You can prepare your children that they probably will not be going back to school. This is, our peak obviously is coming later because we are doing a good job of isolating overall, regardless of what the news says about Wyoming.
The neighboring state of Nebraska, I know, has closed theirs for the end of the year. They did that a couple weeks ago. So.
And look at the peak in Colorado compared to us, we're not that far away. So keep doing a good job out there.
All right, so at this time, I don't have any other questions that have come through. Oh, wait, I spoke too soon. So in concise terms, how do we prepare for our peak to flatten it and keep us safe? What do you recommend?
Wash your hands, social distance, and wear a mask.
And certainly, if you want to support the local restaurants and things, they do carry out, stuff like that, that is safe to do, as far as we know. And supporting the local businesses, I've actually, I never eat out that much, about once a week. I'm actually getting carry out twice a week now, so
That's what
I'm
we're
able
doing
to do that to help the local business. And all these things go into consideration, I think. But the key is the hand washing. When I go to the store, like I said before in the last one, I wash my hands before I go. Now I put my mask on, then I wash my hands afterwards, since I just got my mask today. Thank you for all the people that made the mask for us, by the
Yes,
way.
thank you.
And then I wash my hands as soon as I get home and clean the surfaces I've touched. And I keep social distancing. And that's about all I can say, I guess. You guys got anything else to add, ladies?
A lot of service industries out there that are hurting. I mean, hairdressers and nail salons and car detailing and everything like that. And all of them, I'm sure, will be glad to sell gift cards.
Yeah.
That way they keep some cash flow going now when they need it, and you still have services you can use later.
So do we need to worry about mail and packaging?
That was put out by the Postal Service to put it into a plastic bag for 24 hours. Actually, I've not been able to find a study on that.
You know, I've seen where it lasts on paper for 24 hours and cardboard longer, so it just depends on what they bring you.
Well, it depends on who you read with
Yeah.
the cardboard. Now, steel, one guy published this on steel for 14 days. That's the problem. Everybody's putting out this data, but the data that we can find, that cardboard 24 hours or longer, steel and plastics 12 to 16 hours by reliable sources.
Playground equipment, that's another one. If you
Yes.
don't let your kids go to the park and play on the playground equipment, because it's just going from kid to kid to kid, that they're not sanitizing it between kids, of course, so.
Yeah. And so, if you wanted to be safe, it is reasonable to put it in a paper bag and not, quote unquote, touch it for 24 hours. Once you pick the mail up out of the mailbox, wash your hands immediately. And what I have one of those mailboxes on both sides of my house, so I never touch the other side that the mail carrier, so I don't give it to the mail carrier, I get it unloaded on the other side. Simple things, I guess.
And then kind of going off of what Dr. Abels had said and Dr. Zimmerman about service workers, you know, and everything, it's also something that what I've kind of seen is that unfortunately there's some posts about how like, you know, like, oh, how dare you, like, you know, do dinner for this, or how dare you like charge these prices, blah, blah, blah. Just keep in mind everyone's hurting, so I think it's really easy for us, especially when we're feeling kind of like down, to kind of pass judgment on other people. But really everybody's suffering, and so as much as you can, kind of like Dr. Abels, I don't normally eat out like every single day, but I kind of have been, because you know, you want to make sure that we support our local restaurants, and then also like Dr. Zimmerman said, getting gift certificates, things like that, because you know, in the end, also once this is all over, we want to be able to still have local businesses that we can support, that we can still go to and enjoy, because that's part of, you know, what we love about our small town. So it's just really important to keep supporting, you know, everybody that you don't really think of at this time.
And I haven't seen any sharp price increases in Kroger, City Market, or any of the restaurants I normally go to. Have you guys seen anything?
So given that it is a stressful time for so many of us, can you give some general advice, both from a mental and emotional standpoint as well as a physical standpoint, some things that we can be doing at home for self-care, things that we can be doing to make sure that we're taking care of ourselves so that we can continue to take care of our families and not get ourselves run down, things like that?
There is actually some good studies out that whatever you do, make sure you get 7 to 8 hours of sleep. That boosts your immune system in general, which is important. Simple. That if at all possible, try to do that. And the question is, do you have kids at home? And we're taking care of grandkids because the parents are working, is what we're doing. And when I'm not here. And so keeping them entertained and stuff is a challenge. So I appreciate parents more than I ever realized.
And teachers.
And teachers. And so, simple routines, exercise, believe it or not, games, board games, all sorts of things, activities like that will help people with their mental stress, because this is totally stressful. Because unfortunately, as you've seen, the incidence of domestic violence and child abuse has gone up in these stressful situations. So we need to keep ourselves well, I agree.
Also, I've heard of people having like dinner parties where, you know, they FaceTime each other and they'll eat together and just kind of hang out. So even though they're not actually together, it feels like they are. It feels like they're not alone. So a lot of those also in terms of, you know, there's other games that you can play online with people. And I mean, you know, like, I don't think anyone here plays Fortnite, but, you know, games like Fortnite, you know, it's the ones that you can still talk to people, communicate. Also, sometimes it feels like, oh, it's really hard for me to call this person and like I'm exhausted, but you'd be surprised how if you call them, just how much better you feel. Sometimes it's even just getting that started that then you're able to do more, or, you know, exercising a little bit and noticing, okay, I have a lot more energy, my mood's way better. That can really help, because we've also seen a really sharp increase in DUIs too. So there's just a lot of ways that people are trying to cope, unfortunately, that aren't, you know, the best coping mechanisms that are as safe. So really it's important to kind of take a look at all these different things and kind of what recharges you. Is it something that, like, you know, you love knitting and, you know, maybe just knitting and that kind of helps, or is it FaceTiming, you know, your friends you haven't seen in a year, things like that. Just whatever kind of works for you, trying to do more of that and set aside specific time to do self-care, especially, you know, for non-essential, because it can get kind of boring and lonely where you're like, where's my schedule? I'm just kind of sitting around doing the same thing. And then essential people who feel like, okay, I need to work, you know, 140 hours this week because I need to do this, but then you burn yourself out and then you run yourself down where you get exposed and can potentially get sick.
And exercise is something I've totally neglected and gained 10 pounds during this event. and we still can walk outside, we still can do things like that as long as we maintain social distancing, things like that. But those things can help. And then, of course, if depression increases, which can during these stressful events, reach out to talk to a health counselor, your physician, your nurse practitioner, etc. And because hopefully the counseling center is still operating, as far as I know, trying to help people.
Carbon County Counseling is closed.
But they're doing telephone.
Doing some telehealth.
They're doing telephone, I think. But we need to check on that. Sorry, I do not know that information.
If you have children in the house, right now they're doing the school at home, so you can kind of get a schedule for them. But make sure your kids are still on a decent schedule. I have 5 kids still in the house. We have several Fortniters. I mean, if you didn't intervene, they would be on it all day. So we just have a schedule. I mean, a routine bedtime, regardless, especially when they're still in school, because there's obviously projects they need to have completed at certain times and turned back in, and then we'll phase in the summer.
And I would just echo what they said. Exercise, I think, is a good one. Getting out and walking either yourself or your dog or whatever. I think we're kind of struggling with this ourselves. You know, this is something we had to figure out too. But maybe kind of getting after those projects you've been putting off, or hobbies that you've been wanting to take up that you can do at home. I think now's a good time as any to kind of start on those.
Okay, so we have another question that came through. How long does the virus stay in the air? For example, if you were at the store without a mask and practicing your social distancing, are you still able to catch the virus from simply walking around?
We don't know.
Right now they think it's spread by droplets. And if it drops fairly quickly to the floor, but that's why the social distancing is as important as possible. And it should fall out completely from the air in 20, 30 minutes, but we really don't know. There's one study from Singapore, and that's about all we got.
That's what I looked at too. The problem with that is that they don't know that even though they can detect virus, they don't know if there was enough virus to actually cause the disease. Yeah. And so just because they can detect it doesn't mean it's reached enough level to actually cause anything. So they don't know.
So that's the reason that they've switched encouraging wearing a mask while you're at the store, so that will protect you from the droplets. But once again, if I touch the package and put it back, and I touch my nose before that, that's also a risk. Don't touch your face while you're in the store. Wash your hands also when you leave. Sorry, I don't have specific information.
Okay. So at this point, we don't appear to have any other questions. Is there anything else that the panel would like to add before we close today?
I would just I'd like to kind of thank the community for kind of going along with these recommendations. I think that from what I've seen, the uptake has been really good. At least my patients coming into the clinic, were a little surprised at first, of course, that their spouse or their child or someone couldn't come up with them for their visit, and so that's different. They can't come up and hear the heartbeat. That's a big thing, but everyone has been understanding and has gone along with that, and so we appreciate that. That makes our job easier, so thank you.
So with that, we're going to go ahead and wrap things up today. Thank you everyone for taking time to watch. We plan to continue to host these sessions, hopefully at least every 2 weeks. As things change, we want to continue to keep everyone informed. Please feel free to share this Facebook Live event so that we can continue to make sure that everyone is well informed and that we can all join together as we fight this pandemic. And with that, thank you very much.